I think too often what happens to a chiropractor is a patient or a practice member presents an objection. The doctor stumbles or it makes them question. And that's the killer, is when you don't feel like 100% certain in what it is that you're doing. That kills anything, right? If you're not 100% into what it is that you're doing, then people are going to know that. And if they object and you're like, are you going to stay? If I was going to a service provider and I asked them a question and they couldn't give me a reasonable answer, well, I'd probably look for somebody else.
Well, welcome to the Vitalistic Voice. I'm Dr. Colin Elkin. I am really excited today because in my life, I like to surround myself with people who are smarter than me. And today, I certainly have one of those with us on the podcast today. I have Dr. Monique Andrews with us today. And let me give you, this very well-deserved introduction, Dr. Monique, because, I've been doing some studying about Dr. Monique and my mind is blown about some of the things that she talks about. And I can't believe that I haven't dove into her information and her teaching much before this. So this is going to be a mind-blowing experience for our listeners today. So Dr. Monique, she's a chiropractor, she's a neuroscientist, she speaks internationally, she teaches internationally. She's had extensive years of study and teaching to become an expert with regard to somatic principles, and is an expert in the areas of chiropractic neuroscience, which is an avenue that we as chiropractors, we as a profession need to follow and need to go down. She talks about polyvagal theory, nervous system regulation, how it relates to the subluxation. So we're going to dive into this today. Dr. Mo, as she's fondly known, is the founder of Dr. Mo Knows, which is a chiropractic neuroscience training company, and also the PRANA Foundation, which is a global chiropractic continuing education company, where she's a powerful guide and mentor for those drawn to evolving their wisdom and leaving the world a better place than what they found it. And her vision, and I love this, Dr. Mo's vision is to elevate the consciousness of humanity. Dr. Mo, thank you so much for being with us today.
Thanks, Dr. Colin. Excited to be here and chat with you today and dig into some science, I hope.
Well, I'm absolutely going to dig into some science with you, and I know you're going to blow my mind. Probably going to blow our viewers and our listeners' mind today. So I'd love to know, first of all, how did Dr. Mo get inspired to be a chiropractor? What happened in your life to guide you into chiropractic?
Yeah, well, it's interesting because my path to getting to school was not necessarily an inspired path. Well, it was inspired, but it wasn't by chiropractic. And honestly, I remember when I went to school in Palmer Davenport when it was great. And I was supposed to be at McGill University in Montreal doing my PhD in neuroscience. And when I was a neuroscience research associate in a lab, I met this incredible woman who became my wife later on, but I followed her to chiropractic school. That's how I got there. Now, what truly inspired me about chiropractic was when I heard Reggie Gold give his Triumph of Life talk. And I remember that moment sitting in this old amphitheater at Palmer, and Reggie turned my life on an axis 180 degrees. And I never turned back, because up to that point, I was a scientist. I think I thought I was going to go and be like a glorified physiotherapist. I didn't really know what I was doing. I just knew I was following love of my life. And then I met Reggie Gold, and he's what really inspired me to become a principled chiropractor.
And Reggie, I'm sure, had that effect on many, many people. In fact, we had Irene Gold recently on the podcast, and she was talking about Reggie and some of the stories. So that's an awesome start. So tell me, so where did it go from there? You went to Palmer, and then what happened after Palmer?
Yep. After Palmer, we went into practice. We had a very successful practice in Ottawa, Canada for about a dozen years. And then I was really itching to have more of an impact on what was happening in the profession, because I really wasn't happy with the direction. It was really starting to, the mechanistic side of things was really gaining momentum. And I'm like, how can we change the trajectory of what's happening? And so I decided, I'm like, let's go back and actually start teaching chiropractors. So I went and I was teaching at a chiropractic college for about 6 years, became department chair of basic sciences there, and was really down a path to change I think like my idea was, how can we influence? The best way to influence was probably through getting new young doctors. And after that ended, my wife and I started the PRANA Foundation, which is this continuing education, which really our mission is to equip chiropractors to better serve humanity and to do that from a really principled perspective. And from there, we started, lots of different courses looking at polyvagal theory, and we offer mentorship. We do these retreats. And then I evolved Dr. Mo Knows, which was specifically focused on chiropractic neuroscience. And that's kind of my signature training platform. And that's my jam, to take really complex things and make them accessible to everyone.
Yeah, it's awesome. And I've been watching some of your videos lately, and honestly, and I've been blown away. And I wish I had access to that when I was in practice, for 30 years of practice. And we were very subluxation based. We had a subluxation based practice, but to have the ammunition and the evidence of the relationship of the nervous system and how you have so eloquently explained it in many of your videos and your teachings, if you could have that, or if chiropractors generally could have that in practice, it would greatly expand their practice. So let's dive into this a little bit. So I've seen some studies and some articles that you've just recently released on Facebook. So let's talk a little bit about that. So how would you say, first of all, the subluxation relates to a neurological situation? I like to say a subluxation is a neurological event. So let's kind of talk about that in a
Yeah,
little bit.
yeah. And there are a lot of different opinions. I call them opinion, which is different than a fact or different than, a finding in a research study. There are varying opinions about our impact as chiropractors. There's a whole faction of chiropractic, which I would say is more sort of in the symptom mechanistic based realm, that thinks that when you adjust somebody, all you're doing is impacting the bones and the muscles in the area, that the neurology has nothing to do with it, that it's a local phenomenon. You're decreasing inflammation at the location of the joint. That's it. No neurology involved. And then there's a whole other faction where they say, well, maybe there's some neurology involved, but it's only happening at the level of the cord. Many chiropractors forget that the cord is central nervous system. And then there's people like me and many people in that study the neuroscience, and many of them principal chiropractors, that know and understand that when you adjust the spine, you're actually creating changes in the brain. Of course, we all know the brain, the layperson knows the brain controls every cell, organ, tissue in your body. So when you adjust the spine, if you can change the structure and function of the brain, then you're changing people's whole lives. And I think that if there was one thing I wanted everybody on the planet to know, it would be that when a chiropractor adjusts your spine, they're actually impacting your brain. And of course, the brain controls everything. And this happens in a way that allows you to heal, thrive, and grow. That's the most important nugget right there.
We were talking recently with some clients about how to educate patients in a way. And I recently had Dr. David Fletcher on the podcast, of course, and everybody knows Dr. David Fletcher is the CEO of CLA, which produces the Insight technology, which measures nervous system regulation in the body. And so here's the interesting thing is that the topic of HRV came up. And then when I start watching your videos, when you talk about the relationship of HRV and the vagus nerve, let's dive into that because I found that absolutely fascinating.
Yeah. So, if you're a chiropractor, I'm sure you're familiar with the vagus nerve, cranial nerve 10. It's the longest cranial nerve in the body. It goes from, the brain stem all the way down to every organ, basically from, your neck all the way down to, but excluding the distal third of your colon. So it's a little bit of everywhere. And essentially your vagus nerve is the fastest and most direct route of communication to and from your brain, to all of these organ systems, right? Now, what we know from the science is that if vagal tone is high, that's the desired state. That's where you are feeling connected, where homeostasis is thriving, where you can heal, where you're at the most connected top of the world self. In the opposite realm, when vagal tone is low, you either are maybe stuck in fight or flight, or even worse than that, you're in a freeze response or in immobilization. I talk a lot about polyvagal theory. I won't get into all of that today, but just to say that the way that we can look at the body now is in these three neural platforms. And what chiropractic does is it allows us through the adjustment to actually increase vagal tone and to reduce the sympathetic response. Because when you're subluxated, what we find is this hypersympathetic tone where the sympathetics are really high. And then when people get adjusted, sympathetics drop, parasympathetics come up. That's an indication of vagal tone, because really what HRV is measuring, and I don't want try not to get too complicated here, but really what HRV is measuring is that balance within the nervous system. But the vagus is what predominates because of the neurophysiology behind that. And I dive really deep into that in a course that I have called Applied Polyvagal, which is really a course that's focused on making chiropractors autonomic nervous system informed, right? I call it the polyvagal informed chiropractor. But essentially, it allows us to move our conversations away from pain and symptoms and towards the direction of the nervous system, which is really my primary goal.
This is so cool. And here's the thing and so I'm quite grateful because we were talking about this, and I've actually been doing quite a bit of studying on this lately when I had the conversation with David Fletcher and looking at HRV and the relationship with the vagus nerve and so on. And the fact that, so now when you look at many of these very popular medical websites, WebMD, the Mayo Clinic, when they talk about HRV, they talk about its relationship when you have a low HRV, its relationship to higher levels of diabetes and heart disease and cancer and decreased immune function. And then when we take that into a chiropractic perspective, and we can start talking to people about subluxation and its relationship to the vagus nerve and this HRV change in the body, wow, all of a sudden it takes us completely away from this pain, MSK model of what we get taught in our schools
Yeah.
these days.
Yeah. It's interesting because if you look at some of those same, medical doctors now are starting to talk about occipital-cervical instability, occipital-cervical neurological misalignment. And they've coined a term that represents essentially what it means when you have an upper cervical subluxation that compromises vagal flow. They call it cervicovagopathy. Now, their treatment for cervicovagopathy is injections of various substances and to immobilize the area to accommodate for inflammatory markers and things like that. I think cervicovagopathy essentially is upper cervical subluxation. Well, I don't think it, all of the, we don't have, this is how I like to say, I like to put the crumbs really close together. And we don't have all the science yet that completes that loop in a causal way, but everything points to the same thing, which is when you have an upper cervical misalignment that involves neurological dysfunction because of the position of the vagus, which literally sits right on the TP of Atlas and down the anterior aspect of the cervical spine, you're going to compromise vagal flow. And I have a bunch of studies that look at, different things within how vagus nerve function and even misalignments at C1, C2. And I dive into all of that. That's the kind of thing that we really dive into, because when you understand, there's no question, right? I think too often what happens to a chiropractor is a patient or a practice member presents an objection, and the doctor stumbles or it makes them question, and that's the killer, is when you don't feel like 100% certain in what it is that you're doing. I think that kills anything, right? If you don't feel 100%, if you're not 100% into what it is that you're doing, then people are going to know that. And if they object and you're like, are you going to stay? If I was going to a service provider and I asked them a question and they couldn't give me a reasonable answer, well, I'd probably look for somebody else.
Right. Especially if that answer comes with certainty, and that's the most important thing, right? And
Yeah.
obviously that's what you're teaching. You mentioned something in one of your videos about the nodose ganglion and the relationship with the TP, the anterior portion of the TP of C1. So can you
Yeah.
talk a little bit about that? Because that opens up the whole door for upper cervical chiropractic.
Yeah. So the nodose ganglion is the main sensory afferent ganglia, which basically is a ball of cells, where the cell bodies for a lot of the inputs coming from the body through the vagus nerve. It's that way station where all the cell bodies are for the vagus nerve coming into the brain. And so it's really important. And if you compromise those afferent inputs, and we can go all the way back to freshman text of, Stevenson. If you compromise afferent inputs to the brain, then you distort the signal right away. And it's not, here's the interesting thing. You mentioned the nodos, but then if we look at the superior sympathetic ganglion, which sits just right, almost right next to that, it is the only sympathetic input to the brain. Okay, let me repeat myself. It's the only sympathetic input to the brain that controls a vasoconstriction of blood vessels. It controls the blood flow that's happening to the brain, the face, blood flow to the brain, oxygen to the brain. This is the one ganglia that controls that, sitting right next to this really critical afferent ganglia of the vagus nerve that brings in all of that sensory information. And what we know is that when you're subluxated, if C1 or C2 is misaligned, it compromises that nodose ganglion in a way that the input to the brain from the sympathetics becomes uninhibited. Uncontrollable fight or flight in the brain is what happens. Let me tell you something. That is never a desired situation. Not even when you're in a life crisis. You never want to limit blood flow or oxygenation to the brain. And the science is there. That's not a theory of mine. I'm not, it's very clearly spelled out if you study the anatomy and the physiology of the nervous system and how that interplay between parasympathetic and sympathetic inputs to and from the heart and brain.
This is so brilliant. Now, and so let's talk about that in a practical sense in the office. Take that information, and now how does that apply to chiropractors who want to see more children, especially children with neurodevelopmental disorders like ADD, ADHD, autism, Asperger's syndrome?
Yeah.
How does that all relate?
Yeah, I think when you're working with a really neurodiverse population, I'm actually somebody that's an advocate for doing more training in that particular area. Anytime that you want to specialize, number one, legally, if you want to say that you're a specialist in a particular realm, most states and provinces demand legally that you have some sort of certification. I'm not selling any pediatric certification. I'm just saying that if you're going to, let's say you mentioned a neurodiverse population, if you're going to focus there, then it requires extra training so that you can really serve a population that is struggling and that has special needs. Now, of course, we know that in many of these populations, and I've, given talks on pediatric neurodevelopment, and specifically looking at what happens with neuroinflammation. And we can see that in a lot of these kids, there is neuroinflammation, right? That when you have a brain on fire, it cannot function 100%. Now, the only thing that we can do well, there's more than one thing. We can look at the toxic loads. We can look at the stress and demands. We can look at stress in the family. There's a lot of different factors that we can look at. But we must absolutely make sure that their nervous system is healthy as possible. And that includes, number one, getting adjusted. Number two, making sure they're free of as many toxins as we possibly can. Certainly not putting any new toxins in because we live in an incredibly toxic environment. Like we cannot escape it, right? But yeah, getting adjusted is a key piece. I just posted a study a couple of days ago looking at how when you adjust school-age children, only 12 weeks of care, you see improved quality of life, reduced behavioral disruptions. Huge advocate. If you want to, people always say, if you could only adjust one thing, right? And they want me to say C1. I'm like, if I could only adjust one thing, it would be a baby. Get the nervous system when it's still developing.
Yeah. Amazing. So let's talk about this because I get the privilege of being able to coach a lot of, especially young chiropractors. And here in Canada, we get a lot of chiropractors who graduate from CMCC, which is a very pain-based musculoskeletal therapeutic type of model. And many of them come out almost brainwashed. And I want to use that term specifically, intentionally, brainwashed to thinking that a subluxation-based chiropractor is, and I've actually heard this, and this is common knowledge, on the dark side. So how, yeah, we're called subbies and we're on the dark side. So how can we get this type of information? Because I think every single chiropractor deserves to understand this whole relationship. How do we get this into schools? And is there something that you're doing to facilitate that level of teaching?
Well, one of the things that I did when I taught at a chiropractic college was really taught from this realm where I married the neuroscience with the philosophy. And I think a lot of people, like the subbies, they think that we principled chiropractors are, sitting around reading green books, pontificating on vitalism. And that's not what I do. I study a lot of science, a lot of neuroscience, and I use it in a way like it's not a juxtaposition, to use a pretty, principled chiropractic term, to embrace the philosophy and the science at the same time. And I think one not only informs the other, but it really supports it. And many of my friends who are principled chiropractors are more deeply immersed in the science than many mechanistic chiropractors who think they're just pushing on backs to make people feel better. I can't imagine doing that for a living, chasing pain every single day, when we could be talking about something that nobody else is accessing in the way that we do, which is the nervous system. And if we bring our focus away from the pain game and onto, moving from pain to brain and the impact that we're truly having, and we have science that supports it, we'd see a very big difference. But more of that needs to get out there. Something that I do in my program is for every doc that signs up for Dr. Mo Knows, I give a student scholarship for free. So I match it 1 for 1, just so that we can start to get young students in this realm of thinking sooner than later.
That's incredible. And I was actually going to open that up. So I'd love to know, let's talk about Dr. Mo Knows and what does your
Yeah.
program entail, and tell us exactly what somebody who's interested in learning more about this could get by joining Dr. Mo Knows.
Yeah. So essentially with Dr. Mo Knows, what I do is I train doctors on not just like it's not a big nerd fest where you just come and learn hardcore science. It is that to a certain degree, but in a very accessible way. Like you come, we do a class every month and we learn about some new research area, or, it could be anything from neuroplasticity to concussion to a pediatric neurodevelopment class. And then we break down into a live Q&A. So there's that. So live and on-demand classes that people get CE credits for, even in places like California, where it's pretty hard to get these days. And then we do live monthly case calls. I have an article service where every month you get the breakdown of a new chiropractic science journal article. Again, it's about making it accessible. If you do, people want to sit around reading journal articles? Nope, they don't. Either feel like they can't, or there's just no desire. So what if instead you get the article, key things are highlighted, and here's a 2-page breakdown of the key talking points and how you can use it to educate your patients? Well, that sounds like a pretty good deal to me. I wish I had that, and I didn't. And so I'm creating it, and that's what I've created with Dr. Mo Knows. It has different levels of pricing. If you can't afford, the big ticket full VIP, you can, there's a monthly program. There's all sorts of things. I try to make it accessible as possible. And obviously, as I said, for every doc, I offer free student scholarship.
That's awesome. That's awesome. And you
Yeah.
have an event coming up.
I have a few events. I have a free training. So if people want to get a little taste of Dr. Mo and my style, I have a free training coming up on March 19th. And essentially, and it'll be available after this call as well. Essentially, it's teaching people what are the key things that your patients need to be educated about, right? Number one, that their nervous system controls everything. Number two, if there's dysfunction within that system, then there's going to be dysfunction throughout the body and your entire subjective lived experience. Number three, what we do as chiropractors is actually train your body so that that doesn't happen to you. And then break down some of the science, the key talking points, and no gimmicks. You don't have to buy extra things. All you need to study my program is your head, your heart, and your hands. And at some point, I'd love for that to just be globally available at no cost to everybody. For right now, I'm a human being making a living. I have to charge for my program. But big picture for me is how can we make this accessible to all? And I've done events where I've offered I have a class called Neurology of Subluxation, where I've just offered it free to students all over the world. 2,500 students on a call are just begging for this kind of information because their schools are they're not giving it to them. And I think the more that we can train people to empower their patients with this, miracle that they get to walk around with every day, that's the real jam right there.
That is fantastic. So now here's a question for you, because right now in my life, I mean, we're helping chiropractors with their marketing and helping to market to gain people to come into their office and help to pre-qualify them and educate them into the type of model that they deliver as chiropractors, rather than, so if somebody's a subluxation based chiropractor or wants to focus on that aspect of practice, why would we be running pain-based ads to try to get people in for pain reduction symptoms? So we have specific symptoms or systems to do that. So I'm curious, in your opinion, what practical steps would you put into a practice as far as exam techniques or examination tools to use to help to relay that message or assess the person from a neurological aspect? And also, too, what techniques have you found, knowing what you know now, work the best to reduce subluxation and affect the nervous system in the best way?
Yeah. So that's a great question. Number one, in terms of answering what's the best technique, I'm going to quote Reggie Gold. Well, I think the technique that's the best is the one that actually corrects the subluxation. That's different for different people. So whatever you're really, really good at, get to be the best at it. And that's what you use to deliver the adjustment. Reggie Gold said, it doesn't matter if you hit him in the ass with a shovel, as long as you're correcting subluxation, you're doing your job.
I
I
love it.
think maybe today we can fine tune that a bit better, but just to say to get really good at what you do and to recognize maybe when sometimes people have special needs or they're compromised in a particular way, they might need an upper cervical specialist, they might need a pelvic specialist or what have you, and that we don't have to be the everything to everyone. In terms of how do we shift it from the pain to the nervous system, I actually posted about this a few months ago, and I asked Chat GPT, I'm like, if you wanted to move, if you're a chiropractor, you want to move your practice from pain to the nervous system, what do you do? And it gave me a list of 7 things. Well, it gave me a list of 6, and I added a 7th. I'm not going to remember every one of them right now, but I will tell you some things like changing your intake form so that you actually tell people what you're doing and what your focus is. Making sure that your exam forms are focused in a way that you're focusing on the nervous system, because these are all touch points with your patient that allows you to shift the conversation, right? You're not going to, I used to be chiropractors would be like, I don't talk about pain. Well, if I went to the dentist and I was in pain and the first thing they said to me is, I don't want to hear about your pain, I would go to another dentist, right? So it's not like we're not going to talk about pain, because chiropractic does help with pain. But we move that needle by slowly having all of these different points where we're referencing the nervous system. Intake form, exam form, maybe a health talk that you give, how you lay out any sort of plan of care. Everything needs to focus back to the nervous system. The dialogue always needs to come back. Yep, I see that you're in pain. Here's why, right? Always referring back to the main cause. And then to study it. Number 7 on top of that list for me was join Dr. Mo Knows, because that's exactly what I do is I teach doctors how to take the science and get excited about it and then use that in their practice to educate their patients so that they're changing patient outcomes, but they're also changing their education, because in the perfect practice, it's your patients that are there that are referring new people. Well, you want them to refer based on the fact that you are a doc that focuses not just on pain, but that you work on the nervous system to get to the cause. And that's the best referral.
Incredible. That's great. So, right now, with what you're working on, are you in collaboration with anybody? Are you working with anybody for any specific goals or studies?
Well, I get to ask this all the time. What research are you doing? I don't do what we call bench research anymore. I'm not out there doing the actual studies. What I do is I take all of the studies and I collate that, and then I, put it in a way that's digestible for the practitioner. Yeah. In a practical, evidence informed, clinically relatable way.
Cool. Cool. And
Yeah.
and so what's next for Dr. Mo? Like, what is your big, like right now you're working on Dr. Mo knows, you're doing some teaching. What are the big picture goals 1 year, 2 years, 5 years down the road?
Yeah, for me, I'm just continuing to grow Dr. Mono's. I want it to be as big as possible because I want to get to that place where I can make it free to everybody. In the perfect world, chiropractors would come and learn and train to be the highest level chiropractor that's out there because the biggest challenge that principled, I don't even like to call people chiropractors subluxation based, is that they need to be nervous system based. They need to be neurology based. And if every principled chiropractor was studying with me and we could really elevate our game so that the bullshit that happens out there in the mechanist world, there was just, we could never be stumped. Like put me in a table in a conversation with anybody and you will not stump me because there's so much out there that we can rely on. And I want every principled chiropractor to be educated to that level so that they never feel compromised, they never feel uncertain, and they always know that they're doing the best thing to leave the world a better place than they found it through chiropractic.
So where do you find, what are your biggest challenges right now in making that happen?
Um, I guess it's just getting the word out. Like, when before we hopped on to the recording, you were like, I didn't know about you. And I'm like always surprised when I meet a principal chiropractor that doesn't know about me. I'm not someone that's like hardcore marketing and things like that, but it's literally just getting the word out for what's possible for people. Um, yeah, I would say just getting the word out to more people to know what's possible for them to make an investment because I think there's a lot of, I don't know how else to say this. I think there's a lot of shoddy material out there. There's a lot of CE that's like, I just got to get the CE. I don't care. Right. You turn on a recording or you watch some stuff, you do a test. And I'm like, what a shame that you'd spend a minute of your time and a penny of your dollars paying for crappy CE when you could be getting something exceptional. And that's the kind of feedback that I get on Dr. Mono's and any of the courses that we do at the PRANA Foundation is that it's like a really high level and not just high, like highbrow, like I said about nerding out, like it's really accessible, usable information from a patient outcome perspective, but also from a patient ed perspective.
So other than your own course coming up, do you have any other speaking engagements at any other venues coming up in the near future?
Yeah, I'm speaking down in Australia in May, over in Ireland in September, in Vancouver here in Canada in October. Um, yeah, that's the next few events that are coming up.
Awesome.
Yeah.
Awesome. And if we can facilitate helping you get booked out even more, I'd love to do that, Dr. Mo, because what you can deliver, I think, is so valuable for the profession.
Thanks. Every Monday on my Instagram and Facebook, I post what's called Mo Monday, which is either new research or a new nugget of some kind. I get like so many shares from that, like really usable stuff that people can share, even with their patient base, like on their chiropractic pages or whatever. So follow me on Instagram and Facebook at Dr. Monique Andrews. Check out my Dr. Mo Knows class. That's drmonose.com. And if you're not ready to make a commitment on the Dr. Mo Knows program, which you will not be dissatisfied. I have a free training coming up on March 19th. Again, that'll be available after. You just go to drmotraining.com.
drmotraining.com. We'll put that in the chat below this
Yeah.
video. So, Dr. Mo, this has been awesome. Any final thoughts? Anything you want our viewers to leave with today? Because I know, and here's the thing, is that I know that there's a lot of viewers that watch this podcast that come from a very non-vitalistic platform and want to try to go into that realm and just don't have the knowledge, don't have the tools, don't have the background. They
Yeah.
have a practice that they'd like to grow, or they'd like to transfer from a pain-based musculoskeletal type of practice into more of a vitalistic, subluxation, neurologically based practice. Um, what would you suggest? Final thought.
I yeah, I'd say I'm like a gateway drug to
Awesome.
getting to that place. I'm a gateway drug to get from pain to brain. And everyone that joins Dr. Mo knows, nobody leaves. And I just want to grow it to as big as I possibly can. And that's our greatest chance to making the biggest difference in the world from a principled perspective.
Dr. Mo, this has been brilliant. It's an absolute pleasure to have you on the podcast. You blow my mind. I love, like I said at the beginning, I love hanging out with people that are smarter than me, and I know there's a lot of them. So, but Dr. Mo, you're head and tails. I mean, the stuff that you can articulate so well with relationship to this profession is brilliant, and I definitely would love to see you on more and more platforms. So, thank you so much for being on our show today.
Thanks, Dr. Colin. Appreciate you and I appreciate your support. And let me know if I can help out in any way.